Alrighty guys, so this is part two. This is the second video in the skeletal series that I'm making of your recorded lectures. Today we're going to talk a little bit about how we segment our skeletal system into kind of two systems, I guess you could call them, two kind of categories, and how also we use joints, the major types of joints that we use in conjunction with these bones. So let's go ahead and get started. For starts, the two systems that I need you to be aware of, the two types of regions, we call it the axial skeleton. Now, the axial skeleton is usually composed of your skull, your spine, also your rib cage. And then we also have what we call the appendicular skeleton system, which is mainly your appendages, like your arms and your legs. Now, be aware that we have 80 bones total in our skull and in our spine and our rib cage, and all throughout the axial skeleton there's about 80 bones, and we have about 126 bones in our appendicular skeleton. And so total, we're looking at about 206 bones in the human body. Now, I am not expecting you all to know all 206 bones. That's above the advancement of this course, but we will be learning about 35 of them. So about 35 I will be expecting you to have. So let's just go ahead and get started into what we need. For starts, let's talk about the skull. This is the first part of our axial skeleton I'm going to touch on. The bones of our skull, if you remember the types of categories of bones we have, the skull falls under flat bones. It is designed, of course, to protect. It's to protect the brain. That's the whole main reason why we have the skull, and it also is joined together by these things called sutures. Now, sutures are kind of these joints that are made out of dense fibrous tissue. And so these sutures, you can kind of see it all throughout the skull. I'm going to show you on the next page. Before we get started on talking about sutures, I want you to be aware that sutures are a mature term that we use for a skull that has been more or less fully developed. We usually use sutures when we're talking about adults. However, fetuses and small infants, well, they don't have sutures per se. They have a couple, but not like what you see in an adult skull. They have a lot what we call fontanelles. Now, fontanelles are actually just these wide, gaping regions of the skull that allows the brain to actually grow and expand. And over time, these fontanelles are going to be converted into bone within about 2 years of their life. So toddlers, they have these, and that's part of the reason is because the brain more than doubles in size within the first 2 years of life. So it's very important that these fontanelles are there they're kind of like spacers to allow the brain in order to grow. So we call them fontanelles. So if we look at the skull from a lateral view, from the side, as we say, let's just talk about some of the main bones that you see. But before that, I want you to kind of look at the screen and see how there's like these jagged lines that kind of look like they're connecting all the bones together. These are those sutures that I was talking about before. These are the ones that we find mainly in adults and children even that are kind of, their brains are kind of grown more. So starting off with the skull, we have what we call the frontal bone. The frontal bone is kind of what you feel when you're feeling your forehead. It is mainly where we keep most of our judgments. That judgment center of our brain is right in the front. It's also where we have our working knowledge bank that's happening. And so, of course, the frontal bone is important. We have, moving down, the nasal bone. The nasal bone, please take note that is actually your nose bridge. It's the top part of your nose, closest to around where your eyes kind of meet. It is not the part that is the tip of your nose. Now, the tip of your nose, if you'll remember, is actually made of what we call hyaline cartilage. It's not made out of bone. But the nasal bone is right there up top by the eyes. Then if you move down to the side, kind of where our cheekbone area is, off to the side, we call that the zygomatic bone. It's kind of, if you feel around your face, kind of feel around the side where it starts to look like your face is connecting up around your ear, you will definitely be able to feel that zygomatic bone. Moving down, we have what we call the maxilla. So if you kind of touch around the upper region of your lip, so not necessarily your upper lip, but kind of that bone region above it, we call that the maxilla. And then, of course, our jaw, or what we so often refer to as our jaw scientifically, is called our mandible. So, and that's right below it that you see. Moving off to the side, main huge big portion of our skull is what we call the parietal bone. That's kind of right there at the top where you see. Then where the frontal bone meets the parietal bone, there's kind of a little bone in there that we call the sphenoid or the sphenoidal bone. Moving down from there, we have what we call the occipital bone. The occipital bone is actually where most of our brain matter takes place when we're dealing with our eyes. So anything that deals with eye cognition is usually in the occipital lobe of our brain. And so the occipital bone is what kind of covers that. And then the last of the skull that you need to know bone-wise is what we call our temporal bones. The temporal region of your brain is what deals mainly with hearing. And if you'll notice, you kind of see like a gaping hole, it looks like, right by the temporal bone. That is actually where your ear, the opening to your ear, where you would have like your eardrum kind of right behind it. It's more or less kind of a hole in there behind the tympanic membrane. And so your temporal bone is what that region is covering the part of the brain that deals mainly with hearing. All right, so also within the skull and whatnot, we have these sinuses. They're pretty much just hollow regions within our bones that are designed to drain fluids. So if you've ever had a headache, a sinus headache or something like that, you know exactly what it feels like to have your sinuses congested. And so this usually what happens is when these sinuses get blocked up, the fluid overflows into the nasal cavity, which is kind of where you feel that stuffiness and you start feeling very flu-like, and that's because mainly you have a sinus. Now, a bone that's actually I really want you to be familiar with, and it's because it's kind of unique in a sense, it's called the hyoid bone. And this bone is the only bone in the body, okay, that does not actually form a joint with any other type of bone. It is unique in that sense, and what it does is it actually is at the base of where your tongue attaches, so it really aids you in swallowing and also in speaking. So it's extremely important bone because, of course, all of us need to eat, and many of us are not mute. We actually need to speak, so we really use this bone quite often, but it's interesting that it doesn't actually form a joint with any other bone. Okay, let's talk about our ear. So your ear actually houses some of the smallest bones that you have in your body. The three bones that we find in the middle ear, we call the first one the malleus. Sometimes if you were in younger grade levels, they may have referred to it as the hammer. I do not want you to refer to it as the hammer. It is actually called the malleus. The next one down is the incus, or something you may have heard of as the anvil. And then the last one is what we call the stapes, or what you may have heard of as the stirrup. Now, please do not refer to them, like I said, in their layman terms. I would like you to refer to them scientifically for now, because we are dealing with the skeletal unit, and it's important. So know your malleus, your incus, and your stapes, and they're what actually aids in propagating sound through your cochlea, which will aid you in hearing things. All right, so let's talk about our vertebral column, because this is the next main segment of our axial skeleton. Now, your vertebral column is actually made out of 24 bones, but they're broken up into sections. So the first section, we actually call it our cervical section. It's kind of in that upper region of your back and in your neck. And there's 7 bones actually in the cervical region. The first 2 have special names. The first vertebrae that you have on your vertebral column is actually called the atlas. And then the one that is directly below that, we call that the axis. So out of all of your vertebrae, you do not need to memorize the names of any other ones except for the first 2, the atlas and the axis. Then moving down to like your mid-back, you're going to feel the thoracic area. There are 12 bones in the thoracic region of your vertebrae. And then going further down to your lower back, as we know it, we are going to call that the lumbar region, which there's only 5 in your lumbar, but they're very thick and they're very large because they are actually supporting a lot in that region. And then there are 2 bones that are found below our lumbar region, and those guys are what we call the sacrum and the coccyx. Now, the sacrum and the coccyx, they will actually fuse together depending on your age. There are 9 vertebrae total that make them up, and they will start to fuse, I believe it's after the age of 25. although I'm not exactly sure on that figure, but they will actually begin to fuse together. Before then, they are separated. And here is a picture of it as you see it. You can see the first 7 vertebrae are the cervical, of course the next 12 are the thoracic, and the 5 is the lumbar, and then we have that sacrum and the coccygeal after that. And like I said, you don't need to know any names of them except for the first 2, the atlas and the axis. All right, let's talk about the next and the final, I should say the final portion of our axial skeleton, and that's what we refer to as the ribs and the sternum. So you may have referred to it mainly as your rib cage, and it's really important from a protection standpoint because it protects, 2 of our vital organs, our heart and our lungs, which of course all of us know we need in order to live. Now, there are 3 types of ribs that you can find in your rib cage. The first type is what we call our true ribs, and there's about 7 pairs of those, and they're connected directly to the sternum. The next set that you'll find is about 4 pairs of those, and we call these guys false ribs. And these guys are connected to the sternum, but they're connected through cartilage, okay? And some of them are not even really connected at that. And then the final category that you should know of, and there's only just a couple pairs of these guys, and these are what we call the floating ribs. And we call them the floating ribs because they're kind of like false ribs, except they're only connected to the thoracic vertebrae region. They're not even connected to what we would consider the sternum. So if you look here, you will see that kind of happens. The first, like I said, 7 pairs you can kind of see is the true ribs. After that, we have the false ribs, and then, of course, the floating ones are the ones down below. Now, when we look at the sternum is actually composed of 3 segments. The first part, which is up at the top, we call that the manubrium, and so then in the middle region we call it the sternum, and then finally at the bottom, the little tip that it almost looks kind of triangular or like a little type of arrowhead, we call that the xiphoid process. Okay, so that kind of concludes our axial skeleton, and just to recap, remember in the axial skeleton we have the skull, we have the vertebral column, and then of course we have our rib cage that kind of makes all of our axial skeleton. So now we're going to get into our appendicular skeleton, which is the other category, I guess you could say, we find our bones in. And so the appendicular skeleton, it is oftentimes referred to this as such because it's mainly composed of our appendages. Our appendages is a nice fancy word for just our limbs, our arms and legs. So that's why they call it the appendicular skeleton. And let's go ahead and get started with the first region, I guess. So the first part of our appendicular skeleton that I'm going to do, you kind of see the whole skeleton here right now, so I'm just going to cover the appendicular part. And the first one that we will find is our clavicle. Now, your clavicle is sometimes referred to as your collarbone. You can actually feel it if you want. It's kind of the one that kind of runs across like the width of your shoulders. And so that is what we call the clavicle. Now, from there, if you move down to your back region, you can actually feel it. It kind of looks kind of triangular, like a wing on both sides. We call it the scapula. And moving from there, we move into our arm region. And our arm, the top one that's in your main part of your arm, that kind of is where your bicep and tricep is, that bone is what we refer to as the humerus. Now, moving from the humerus down into the forearm area, we will not find just one bone like we found with the humerus. We'll actually find 2. And so these 2 bones, the first one is what we call the radius, and then the second one is what we call the ulna. Now, the radius and the ulna, they work in tandem with each other in order for us to get full range of motion. They kind of slide past each other, joints and whatnot. You can actually feel it if you kind of press in on your forearm. You can kind of feel where they separate between the 2 of them. Moving down from there, if we were to look further into our hand, we're going to first hit our wrist area. And the short bones that make up your wrists are actually called the carpals. And if you move from the carpals, as you kind of go down your hand looking at it from the top spot, you're going to, the bones that make up kind of your palm region, but on the top is going to be called our metacarpals. And then, of course, your fingers are what we call phalanges. Sometimes you'll also hear your fingers referred to as digits. It's the same thing. And these guys, like I said, are called phalanges. So moving into the bottom part of our appendicular skeleton, we're going to see first our pelvis or our pelvic bone. That whole region, like I'm pointing to, is what we consider the pelvis. And moving down from there, our bone that's kind of inside of our thigh region, we refer to him as the femur. And the femur will be connected to a round type of bone or a circular looking bone in our kneecap called the patella. And then just as we saw when we were looking at our arm, how the bone that was proximal, okay, moving towards our trunk, okay, from the top region of our arm, we saw that it only had one bone, and as we moved distal down the arm, we noticed that we had two bones that were making up our forearm. Well, the same is true when you're looking at your legs. So your top bone, the one that is proximal to the body, is the femur, and it's only a single bone. But as you move down into your lower end of your leg, kind of where your calf is, you're going to notice that you have two bones that are making up that region. The first one is called the tibia, and right beside it we refer to it as the fibula. And so the tibia and the fibula will also work in tandem with each other, just like we saw that with the other bones in the arm, which if you are paying attention, that was the radius and the ulna. So moving down from there, okay, we're going to kind of get a region where it's around our ankle. And the first bone that we come to is called the talus, the talus. And the talus is, it's in our ankle region, as I said. And then moving down a little bit further, we're going to hit what we call our tarsals. Now, our tarsals are just like what we saw in our wrist, are very similar, I should say, as we saw in the wrist. And if you remember properly, the wrist is actually referred to as the carpals. And so when we're talking about our legs or our feet, we're going to refer to the feet one or the ankle one as the tarsals. And then moving down from there, just as we had the metacarpals in our hand, well, we're going to have metatarsals in our feet. And the only thing that's the same when you're talking about both your fingers and your toes, we refer to both of these as the phalanges. So you've got that the same no matter what. So that's usually easier to remember.